Thanks very much, Lee. I'm Mark Friedlander. I'm a board-certified child and adolescent psychiatrist, been in the provider community for a long time, but in my new role, I'm on the payer side. And some of what I have to say may not be that popular, but I just want to kind of go over some of the challenges that we on the payer side, the insurer side, are facing when it comes to addressing the crisis of individuals with conditions on the autism spectrum. So there are a number of challenges that we have here. And clearly, commercial health insurance, private health insurance, the private health plans that many of you belong to have a role to play in addressing this crisis. But we're just one piece of the puzzle. There are public resources, there are educational resources, there are various county and state agencies, all of which have a role. And what we've been seeing, and I'm speaking about this purely from the perspective of the private health insurer, is that there is a nationwide trend at the moment to try and shift a portion of the costs and a portion of the responsibility over to the commercial health insurance plans. And that makes sense. A lot of the services that individuals with conditions on the autism spectrum need are health services. It's entirely appropriate that health plans step up and provide those services and do not shirk their responsibilities. But there needs to be a give and take. There needs to be a fair compromise between what is the responsibility of the education system, what is the responsibility of state, what is the responsibility of society, and what is truly just a health problem. Now, the challenges that we face within the insurance community, and one of the values that we add to this whole debate is being able to track and trend and monitor and identify individuals. We receive claims from pharmacies, from disability carriers, from individual physicians, from various therapists, and we're sitting on a mountain of data. And we use those data to try and identify opportunities where our intervention can make a difference. Our role in Aetna Behavioral Health is not so much trying to limit costs, but trying to figure out for the employer who pays the premium how best to utilize the resources. Where's the dollar best spent? How do we figure out where does spending money on an intervention result in a return for that employer? And it's difficult to do because of a number of challenges that we face. Firstly, our provider community has been the victims to a great extent of the design of benefit plans in the past. Many of them have learned that if you label a patient as having autism, there's just not going to be payment. So they have worked with individuals with conditions on the autism spectrum and emphasized some of the other issues that maybe they're facing. So when we receive claims and they come in with a diagnosis of impulse control disorder or adjustment disorder, we don't know whether that truly is an impulse control disorder or an adjustment disorder, or is kind of a code for an individual with a condition on the autism spectrum. And it's very difficult for us to search our claims database and identify truly what is going on and truly what services make most difference. There also is no code for ABA, Applied Behavioral Analysis, one of the treatments that, by Aetna policy is covered and is medically necessary and is not an excluded service on the basis of being experimental or investigational. But there's no specific code for a provider to use that we can recognize when ABA is being provided so that we can reach out to those providers, figure out if there's any role for us as health insurers to facilitate referrals for other services that individual may need. The other challenge that we're facing from the health insurance perspective is the overlay of state mandates and state regulation. There's also the federal parity bill that goes into effect in October, and it's unclear exactly what kind of an impact all of this has. If you think of it from the perspective of Aetna, and I'm referring to Aetna because that's the business I know best, most of our business is the employer's dollar. So the large corporations are at risk for the medical costs that their employees and dependents generate. It's not Aetna's dollar, it's the employer's dollar. They pay us a fee to negotiate network discounts and build a network and to provide some additional value, but it's their dollar. And what we've got to figure out with them is what makes most sense when they're spending their money. And that's mainly what value we add. It's not that if services are denied, it generates revenue for Aetna. It's purely, this is what the employer wants us to do. We administer the plan the way that they have designed it. Now, applied behavioral analysis is, in many regards, the hot button issue for many of us. And that the challenge for us in the health plan side is that it is a somewhat ambiguous term. It's not really clear in terms of providers, methodologies, what makes most sense. The traditional approach within the behavioral health area on the health plan side is to figure out what makes most sense for an individual, to try and individualize a treatment plan, and we've heard other speakers talk about individual differences and the great variability we see. But we also know that not everybody responds to ABA. We know that not everybody needs 40 hours a week. Some folks may require lesser amounts. Some folks may require more than 40 hours a week. But it's very difficult to figure out how to anticipate what an individual will need. And there certainly isn't the kind of scientific evidence that we require to be able to say, by policy, this individual is going to get coverage for this amount. That individual, for whatever clinical reason, is not going to receive that because it just isn't going to make a difference. Now, for the employers, their challenge is if they buy a policy from us, or if they designate in their plan documents that we are to administer a policy that includes coverage for applied behavioral analysis, it's kind of an on or off switch. There's no dimmer control. It's they cover it or they don't cover it. If they cover it, there is the potential for significant costs. If they don't cover it, they're not entirely protected from catastrophic cases, but to a greater extent, they're able to manage their costs. And many of the large corporations are turning to us in the behavioral health area and asking, what do you advise? What makes most sense? And the answer that we're giving them from the behavioral health perspective is that we know that ABA makes a difference. We know that ABA is evidence-based treatment. We know that it can result in significantly positive outcomes for the majority of individuals if it's done correctly by appropriate providers to an appropriate extent. But ultimately, the decision is made by the employer.